Hello everyone, I am delighted to welcome you all. My name is Rana. I'll continue what I talked about in a previous lecture, the developmental defect of the oral and maxillofacial region. The objective of this lecture, introduction, clinical feature, histopathological feature, and the treatment. First, we're gonna start with the macroglossia. Hypoglosia is an uncommon developmental condition characterized by abnormally small of the tongue. In a rare instance, virtually the entire tongue may be missing, and it's called aglossia. The treatment depends on the condition and the severity of the patient. It could be surgery and orthodontic to improve the oral function, and sometimes we need to speech development. The macroglossia is enlargement of the tongue caused by a wide variety of conditions, including congenital malformation and acquired disease. In acquired disease like edentulospacia, amyloidosis, myxedema, acromegaly, angioedema, myasthenia gravis, amyotrophic lateral sclerosis, and carcinoma and other tumor. In congenital and hereditary vascular malformation, lymphangioma, hemangioma, hemihyperplasia, creatinism, Beckwith-Wiedemann syndrome, Down syndrome, Duchenne muscular dystrophy, mucopolysaccharidosis, neurofibromatosis type 1, and multiple endocrine neoplasia type 2b, but the most common is vascular malformation and the muscular hypertrophy. Clinically featured, the macroglossia most commonly occur in children and can range from mild to severe. Macroglossia manifested first by noisy breathing, drooling, and difficulty in eating. The pressure of the tongue against the mandible and teeth can produce crenated lateral border of the tongue, open bite, and mandibular bruganthism. Mandibular bruganthism means where the lower jaw mandible protruded forward more than it should be in a relationship with the upper jaw, the maxilla. If the tongue constantly protruded from the mouth, it may be ulcerated and become secondary infection or may even necrosis. We have some condition with a specific feature of the tongue like hypothyroidism. Hypothyroidism when the thyroid gland does not make enough thyroid hormone to meet your body needs. The tongue usually shows diffuse, smooth, and generalized enlargement. In a patient with lymphangioma is a benign tumor-like growth of the lymphatic vessel. The tongue surface will be bubbly and exhibit multiple physical-like blips that represent superficial dilated lymphatic channels. Down syndrome. The Down syndrome is a genetic congenital defect in chromosome 21. The tongue demonstrated papillary and fissured surface. In a patient with hemifacial hyperplasia, the enlargement will be unilateral. The edentulospacia. The edentulospacia, edentulous means toothless either completely or partially. The tongue often appear elevated and tend to spread out laterally because of the loss of the surrounding teeth. As a result of wearing a denture may become difficult later on. There is no histological abnormality. The treatment depends on the cases and the severity of the condition. In a mild cases, surgical treatment may not be necessary, although speech therapy may be helpful if the speech affected. In a symptomatic patient, reduction glossectomy. The glossectomy means surgical procedure involving the removal of all or part of the tongue. Okay, Then the ankyloglossia, tongue tie, is characterized by short and thick lingual frenum, result in limitation of the tongue movement. It's more common in boys rather than girls. Clinically feature, the ankyloglossia can range in severity from mild cases with a little clinical significance to rare example of complete ankyloglossia, which is the tongue is actually fused with the floor of the mouth. It is possible that high mucogingival attachment of the lingual frenum may contribute to gingival recession and difficult in speech. The treatment, because most cases of ankyloglossia result few or no clinical problem, treatment is unnecessary. For infants with a specific breastfeeding problem, we can use frenotomy. Frenotomy is a surgical procedure to release a tongue tie. Children or adults with association functional or periodontal difficulties use frenoplasty. The release with a plastic repair. It may allow greater freedom of the tongue movement. In young children, it often is recommended that surgery by postponed until age 4 or 5 because the tongue is always short at birth. Okay, lingual thyroid. Thyroid gland is a butterfly-shaped gland responsible for the hormonal control that regulates the metabolism, growth, and the development. The lingual thyroid, or the thyroid, normally in a 7 embryonic week, the thyroid but normally descending into the neck. It is finally resting on the position anterior to the trachea and the larynx as the left photo. The site where this descending but invaginated lateral become the foramen cecum, located at the junction of the anterior 2/3 and posterior 1/3 of the tongue in the midline, like the right photo. If the primitive gland does not descending normally, ectopic thyroid tissue may be found between the foramen cecum and epiglossitis. Clinical feature, it asymptomatic remnant of thyroid can be discovered on the posterior dorsal of the tongue. The symptomatic lingual thyroid much less common and are 4 to 7 times more frequently in female because the hormonal influences symptom developing during the puberty, adolescence, pregnancy, or menopause. Lingual thyroid will range from small asymptomatic nodular lesion to the large mass that can block the airway. The most clinical symptoms are dysphagia. Dysphagia means difficult in swallowing, and dysphonia. Dysphonia means having abnormal voice, and dyspnea. Dyspnea means the feeling short of the breath. The hyperthyroidism has been reported in 33% of the patients. Diagnosis is best established by thyroid scan using iodine isotopes and technetium 99M. CT, MRI, and ultrasonography can be helpful in delineating the size and the extent of the lesion. In some cases, incisional biopsy may be needed to confirm the diagnosis. The treatment, there is no treatment except a periodic follow-up is required for patients with asymptomatic. With the symptomatic patient, use suppressive therapy with supplemented thyroid hormone, often can reduce the size of the lesion. Hormone therapy does not eliminate the symptom. Surgical removal or ablation with radioactive iodine 131 can be performed. Okay, the fissured tongue. Fissured tongue is a relatively common condition that is characterized by presence of numerous grooves and fissures on the dorsal of the tongue surface. Clinically feature multiple grooves or furrows on the surface of the tongue, ranging from 2 to 6 mm in depth. It usually asymptomatic. Also, some patients may complain of mild burning or soreness. The condition may be seen in children or adults. The severity increases with the age. Fissure tongue also may be component of Michelson-Rosenthal syndrome. Histopathologically, a hyperplasia of the ridge and loss of the keratin on the surface of the filiform papilla. Polymorphonuclear leukocytes can be seen migrating into the epithelial surface. The treatment, there is no specific treatment is indicated. The patient should be encouraged to brush the tongue by tongue scrubber or toothbrush because of the food or debris interrupted into the groove may act as irritation. Hairy tongue is a marked accumulation of keratin on filiform papilla of the dorsal of the tongue, resulting in hairy-like appearance. It represents an increase in keratin production or decrease in a normal keratin disequation. You can see in both photo. This photo have a white color. The other photo have a brown color. We have many cases affected the people with poor oral hygiene, heavy smoker, drug that induce xerostomia, and history of radiation therapy to the head and neck. Clinically, feature most commonly affected the midline, just anterior to the circumflate papilla. You can see in the photo the circumflated papilla with the arrow. Sparing the lateral and anterior borders, the elongated papilla are usually brown, yellow, or black as a result of the growth of pigment producing bacteria or staining from tobacco and food. The condition is asymptomatic. Also, patients complain of gagging sensation or bad taste in the mouth. In some individuals, numerous bacteria and desquamated epithelial cells accumulated on the dorsal of the tongue surface, but without the hair-like filiform projection is a coated tongue like the right photo. Often is misdiagnosed or diagnosed as a candida. Transitory black staining of the dorsal tongue without elongation of the filiform papilla, like the left photo, can occur in a patient who with bismuth subsilicate to control the upset stomach. The bismuth is such preparation can react with accumulation of the tongue surface, trace amount of sulfur on the salivary to form bismuth sulfide. However, its discoloration rapidly resolve after disconnection of the discontinuous the medication. Histopathologically, the tongue is characterized by marked elongation and hyperkeratosis of the filiform papilla. The treatment, the major concern is often the aesthetic appearance of the tongue, along with a possible association with a bad breath. Any predisposing factors such as tobacco should be eliminated, and excellent oral hygiene should be encouraged. Periodic scrubbing or brushing with a toothbrush. Avoid confusing hairy tongue with a hairy leukoplakia. The hairy leukoplakia occur in the lateral border of the tongue, and it caused by Epstein-Barr viruses and usually associated with human immunodeficiency virus, HIV patient, or other immunosuppressive condition. Verrucositis or ferrucity is abnormally dilated and of the vein, common in adults. It loses connective tissue supporting the vessel. Clinical feature, the most common type of oral verrucosities is the sublingual pharynx, which occur in the people older than 60 years of age. Sublingually verrucositis classically present as a multiple blue or purple elevated or papules on the ventral and lateral border of the tongue. It is asymptomatic in rare cases when secondary thrombosis occur. Less frequently solitary varices occur in other areas of the mouth like lip and buccal mucosa. Histologically dilated in the vein, the wall which show little smooth muscle and poorly developed elastic tissue. If secondary thrombosis has occurred, the lumen may contain concentrically layered zone of the platelets and erythrocyte. It called line of Zahn, like the photo. The treatment, no treatment is indicated. Solitary fucositis, the lip and buccal mucosa may need be surgical removal to confirm the diagnosis or for aesthetic purpose. The caliper persistent artery, common vascular anomaly in which a main arterial branch extends up into the superficial submucosal tissue without a reduction in the diameter, more common in adults. Clinically, feature occurs almost exclusively in the lip mucosa. Either lip may be affected. Some patients have a bilateral lesion or lesion in both lips. A lesion presents a linear arcuate or papule elevated that range from pale to normal to bluish in color. Stretching the lip usually causes the artery to become inconspicuous. The unique feature is a pulsation. The lesion is usually asymptomatic. Rarely a patient noticed the pulsatile lip nodule. A few cases have been associated with ulceration overlying the mucosa. Histologically, show a thick-walled artery situated closely to the mucosal surface. The treatment, the true nature of the caliper persistent artery can be recognized clinically. There is no treatment is necessary. Often biopsy performed when the lesion is mistaken for mucocele or another vascular lesion such as a pharynx or hemangioma. In the end, we're gonna talk about the lateral soft palatal fistula is anomalies of uncertain pathogenesis. Many cases appear to be congenital, possibly related to a defect in the development of the second pharyngeal pouches. Clinically feature, the lateral soft palatal fistula usually are bilateral, but they may occur only in the one side. They are more common in anterior tonsillar period. The perforation typically is asymptomatic. It ranges from few millimeter to more than 1 centimeter. Few cases have been associated with other anomalies such as absence or hypoplasia of the palatine tonsil, hearing loss, and periocular fistula. There is no treatment necessary. Thank you for all for the listening, and I appreciated you all taking the time to listen this lecture with the dental camp. Have a good day.